What is the first medication administered during ventricular fibrillation arrest? A. Amiodarone. B. Atropine. C. Epinephrine. D. Magnesium. Answer: C. Epinephrine is administered first during VF/pulseless VT after CPR and defibrillation. What is the recommended energy dose for the first defibrillation in adult VF? A. 50 joules. B. 100 joules. C. 120 to 200 joules. D. 300 to 360 joules. Answer: C. Use biphasic defibrillators with 120 to 200 J as the recommended starting dose. Which rhythm is not shockable during ACLS? A. Ventricular fibrillation. B. Pulseless ventricular tachycardia. C. Asystole. D. Torsades de pointes. Answer: C. Asystole is a non-shockable rhythm and is treated with CPR and epinephrine. What is the correct compression to ventilation ratio for adult CPR without an advanced airway? A. 15:2. B. 30:2. C. 5:1. D. 20:2. Answer: B. The correct ratio is 30 compressions to 2 breaths when no advanced airway is in place. How often should epinephrine be administered during cardiac arrest? A. Every 2 minutes. B. Every 3 minutes. C. Every 5 minutes. D. Every 3 to 5 minutes. Answer: D. Epinephrine is given every 3 to 5 minutes during cardiac arrest situations. What is the first step when finding an unresponsive adult patient? A. Start CPR. B. Check for a pulse. C. Activate emergency response. D. Give oxygen. Answer: C. Activating the emergency response system is the first step in ACLS if the person is unresponsive. Which medication is recommended for symptomatic bradycardia? A. Epinephrine. B. Amiodarone. C. Atropine. D. Adenosine. Answer: C. Atropine is the first-line drug for symptomatic bradycardia in ACLS. What is the target oxygen saturation, SpO2, for post-cardiac arrest care? A. 80 to 85%. B. 85 to 89%. C. 90 to 94%. D. Greater than or equal to 94%. Answer: D. Oxygen should be titrated to maintain an SpO2 greater than or equal to 94% in post-resuscitation care. What is the correct ventilation rate during CPR with an advanced airway? A. 12 to 20 breaths per minute. B. 8 to 10 breaths per minute. C. 6 to 8 breaths per minute. D. 20 to 24 breaths per minute. Answer: B. Give 1 breath every 6 to 8 seconds, 8 to 10 breaths/min, without pausing compressions. Which rhythm is characterized by a regular, wide complex tachycardia? A. Atrial fibrillation. B. Ventricular tachycardia. C. SVT. D. Sinus tachycardia. Answer: B. Ventricular tachycardia presents as a wide complex, regular tachycardia. What is the first action if you find a patient unresponsive with no breathing but a pulse? A. Start compressions. B. Start rescue breathing. C. Apply AED. D. Call time of death. Answer: B. If the patient has a pulse but is not breathing, give rescue breaths. What drug should be avoided in the treatment of torsades de pointes? A. Magnesium sulfate. B. Amiodarone. C. Lidocaine. D. Atropine. Answer: B. Amiodarone may prolong the QT interval and worsen torsades. What is the most reliable indicator of effective CPR? A. Chest rise. B. Color improvement. C. Palpable pulse. D. EtCO2 greater than or equal to 10 mm of mercury. Answer: D. Capnography reading greater than or equal to 10 mm of mercury suggests effective chest compressions. Which of the following rhythms requires synchronized cardioversion? A. Asystole. B. SVT with hypotension. C. Ventricular fibrillation. D. Pulseless VT. Answer, B. Synchronized cardioversion is used in unstable tachycardias like symptomatic SVT. Which ACLS drug can cause flushing and brief asystole when treating SVT? A. Amiodarone. B. Adenosine. C. Epinephrine. D. Lidocaine. Answer, B. Adenosine briefly blocks AV conduction, sometimes causing transient asystole. When is it appropriate to administer magnesium sulfate in ACLS? A. For symptomatic bradycardia. B. For pulseless VT. C. For torsades de pointes. D. For unstable atrial fibrillation. Answer, C. Magnesium sulfate is the first-line treatment for torsades de pointes. What is the recommended 4-dose of atropine for bradycardia? A. 0.1 mg. B. 0.5 mg. C. 1 mg. D. 2 mg. Answer, B. Give 0.5 mg for bolus, may repeat every 3 to 5 minutes up to 3 mg total. What is the preferred route for drug administration during cardiac arrest? A. IM. B. SC. C. For /IO. D. Oral. Answer, C. Intravenous, or intraosseous, IO, access is preferred in emergencies. Which of the following conditions is not an H or T cause of cardiac arrest? A. Hypokalemia. B. Hypothermia. C. Tension pneumothorax. D. Tachycardia. Answer, D. Tachycardia is not one of the reversible HS and TS in cardiac arrest. What is the main reason for providing rapid defibrillation in cardiac arrest? A. Improve oxygenation. B. Reduce pain. C. Restore normal heart rhythm. D. Slow the heart rate. Answer, C. Rapid defibrillation improves survival by restoring a perfusing rhythm. Which of the following is a shockable rhythm? A. P. B. Asystole. C. VF. D. Sinus arrest. Answer, C. Ventricular fibrillation, VF, is a shockable rhythm. What is the maximum total dose of atropine for bradycardia? A. 1 mg. B. 2 mg. C. 3 mg. D. 4 mg. Answer, C. The maximum cumulative dose of atropine is 3 mg. What should be done immediately after a shock is delivered? A. Check for pulse. B. Analyze rhythm. C. Resume chest compressions. D. Wait 30 seconds. Answer, C. Continue CPR immediately after defibrillation without rhythm or pulse checks. Which of the following is a reversible cause of pulseless electrical activity, PA? A. Hypoxia. B. Sinus tachycardia. C. First-degree AV block. D. Premature atrial contraction. Answer, A. Hypoxia is a reversible cause and should be addressed during PA management. What is the compression rate for high-quality CPR in adults? A. 60-80/min. B. 80-100/min. C. 100-120/min. D. 120-140/min. Answer, C. High-quality CPR requires 100 to 120 compressions per minute. What medication is used after the third shock in refractory VF/pulseless VT? A. Atropine. B. Amiodarone. C. Adenosine. D. Lidocaine. Answer, B. Amiodarone is given after the third shock if VF/VT persists. In ACLS, what is the primary assessment mnemonic used? A. ABCDE. B. Sample. C. OPQRST. D. CABD. Answer A. The ABCD mnemonic in ACLS guides providers to systematically assess and address airway, breathing, circulation, disability, and exposure for rapid identification and treatment of life-threatening conditions. Which device is used to measure end-tidal CO2 during CPR? A. Pulse oximeter. B. Defibrillator. C. Capnograph. D. Glucometer. Answer C. Capnography measures exhaled CO2 and CPR effectiveness. Which action improves survival during in-hospital cardiac arrest? A. Delaying CPR. B. Delaying defibrillation. C. Early activation of code team. D. Waiting for advanced airway. Answer C. Early recognition and response are key to improving survival. What is the dose of amiodarone for the first administration during cardiac arrest? A. 100 mg for. B. 150 mg for. C. 300 mg for push. D. 450 mg for push. Answer C. The first dose of amiodarone in cardiac arrest is 300 mg for push.